welcome to the Wellness Minute, a show dedicated to informing you about health and healing modalities to aid in the prevention and management of, and in some cases, the treatment of various health diseases. I'm your host, Dr. Abigail Ayapola. According to the CDC, cardiovascular disease, more commonly known as heart disease, is the #1 killer of men and women in the United States. Familiar medical terms or conditions like high blood pressure, irregular heartbeat, high cholesterol, and stroke all fall under this month's topic of heart disease. I'm here with two special guests today, Dr. Juanita Cox and Dr. Randy Gastwert. They're both naturopathic physicians. They promote integrative medicine and preventive health, and they do a number of other things in the way they practice. Thank you both for joining us today.
Thank you.
Can you both share a little bit about, we'll start with you, Dr. Cox, how do you practice? How did you come to do what you do? And what other degrees do you have?
Well, I'm a naturopathic doctor, as you mentioned, and also a dietitian nutritionist. Also have a master's in acupuncture, TCM, traditional Chinese medicine. And in my practice, I focus primarily on nutrition therapy. So I focus on chronic diseases such as high blood pressure and diabetes. And in doing so, I couple that with medical nutrition therapy along with evidence-based medicine to treat the individual, manage their condition, and even prevent it as well. So I just utilize foods and all the nutrients, the vitamins, the minerals to help the individual on a cellular level and help them to get healthy again.
You stay busy, don't you?
I do.
Dr. Gastwert, yourself, your background, and how do you practice?
So I'm also a naturopathic doctor, and I tend to see patients of all different concerns and use natural therapies, which might include nutrition and diet, herbal medicine, as well as supplements, and also mind-body therapy. And most of my practice is really informed by my previous career as a scientist. I have a PhD in biomedical science. And that's really influenced me to look at both natural medicine as well as conventional medicine from an integrative, science-based stance. And so I really like to work with my patients' other providers, including their medical doctors, to ensure that we are using evidence-based medicine, like Dr. Cox talked about, to get the best results in their health.
So, Dr. Cox, can you tell us how cardiovascular disease occurs as a result of nutritional deficiencies?
Yes, absolutely. Well, nutritional deficiencies often cause an array of symptoms, ailments, and concerns from patients. And patients come in all the time, but primarily when you're looking at the heart, there's a few main nutrients that you should be concerned about, especially if you're deficient. One of the most prevalent ones would be magnesium. Magnesium is the 4th most abundant mineral in the body, mostly concentrated in the bones, muscles, and in the heart at a value of 90%, whereas only 10% is found in the bloodstream, concentrated in the bloodstream. So if you're deficient in magnesium, you can actually have heart palpitations. And that is a big concern because I've had many patients come to me with the concern of heart palpitations for over 2-3 years that they can't get rid of, and in office gave them magnesium. By the time they left, they went home within an hour or so, completely gone. You can find magnesium in abundance in foods such as beans, any dark green leafy vegetables. That's chard, spinach, collard greens, and even whole grains.
Nice. Okay, magnesium. Good to know. Any other nutrients you would recommend?
CoQ10 is a big
one.
And under CoQ10, as you know, there's 2 forms, ubiquinone and ubiquinol. Ubiquinone actually produces ubiquinol. And with aging, you have a deficiency of CoQ10. So with CoQ10 decreasing, a plethora of health concerns, primarily cardiovascular, comes about. So this fat-soluble ubiquitous molecule often helps to reduce cardiovascular events. It also works great with cholesterol. So as you know, cholesterol has absolutely no symptoms. High cholesterol is known as a silent killer. So consuming foods such as organ meats, liver and kidney from animals, in addition to, if you're vegetarian, cauliflower, broccoli, and asparagus can get you just as the amount of just the amount of CoQ10 you need.
So you don't have to supplement to get these things.
You do not.
Interesting.
You do not.
I'll ask you
Comes from the earth.
I like that.
Yes.
Dr. Gaspard, is there anything you would add to the nutritional deficiencies from the naturopathic's perspective or the biomedical?
Well, I would agree with Dr. Cox on what she spoke about, and just wanted to add that in general, diet is a concern with people who have heart disease, and also a interesting point when you're trying to prevent heart disease. It's been shown generally that a diet that is lower in animal fats and higher in vegetable fats can play a role in significantly improving the function of your cardiovascular system. In the research, the Mediterranean diet, the vegetarian diet have both been shown to be superb ways of intervening and preventing cardiovascular disease, often because they reduce animal saturated fats and they increase the fats from vegetables. And so as a general dietary advice, those two types of diets seem to play a role in keeping your heart healthy.
For those of you who may already have a form of heart disease, don't worry. There are, in fact, nutritional and herbal compounds that are capable of preventing, managing, and even treating different forms of heart disease. Stay tuned to find out. Life is full of choices, from what we're going to wear each day to what we're going to do over the weekend. You know what else is a choice? Your heart health. Most of the conditions that cause heart disease are actually lifestyle choices, from what we eat to how active we are to our use of alcohol or tobacco products. These are all lifestyle choices that we make that can affect our heart health. Make the right choice today and schedule an appointment with your doctor to figure out which are the right lifestyle choices for you. Life is full of choices, so why not choose your heart? Welcome back to the Wellness Minute. Just before the break, we were discussing how nutritional deficiencies cause heart disease to occur, and that there are ways to relieve symptoms, prevent heart disease, and even manage current conditions by using nutritional or herbal therapies. Dr. Gaspard, can you talk to us about herbal therapies? How do they impact, what kind of herbs impact cardiovascular diseases, and how does it work in the body?
Well, there are a number of herbs that are used for heart disease, and some of them are more common in the knowledge of the public. And what I really wanted to speak to was some of those that you may have heard of, and that whether or not they work. So the first herb that is pretty popular is garlic. A lot of people know garlic from cooking, but it turns out that garlic is actually a great herb for cardiovascular disease, for heart disease. It's been shown that garlic can actually help lower cholesterol, and when eaten together with a high-fat meal, actually shows that the cholesterol is less likely to be in your blood long-term from that meal. Garlic has also been shown to have great effect on blood pressure. It lowers your blood pressure. The great thing is that you can include it in your diet. You can cook with garlic, you can eat garlic raw, which not a lot of people love to do, but it definitely holds its effects when it's cooked. So it's a great thing to include in your everyday cooking. Now, with certain people, garlic may be needed at higher dosages. In fact, some of the studies that have looked at garlic do require doses that you don't necessarily get in food. And so if you're one of those people, it would definitely be important to speak with someone who knows about herbal therapy, like a naturopathic doctor or an herbalist, and they can advise you on how much garlic to use, and that may lead to you using the garlic in a pill form. So lots of ways to get garlic into your diet, and it definitely works. Another popular herb is ginkgo biloba. Many people know it, and it is also a great herb for cardiovascular disease. Ginkgo biloba more specifically works on the vasculature. It helps lower blood pressure and helps improve circulation both to your legs if you have peripheral vascular disease, but also to your brain if you're having issues with the circulation in your brain. Yes. Ginkgo biloba also been shown to lower blood pressure. Ginkgo biloba it's a great herb to use, but again, there are cautions with it, especially when you're using it at therapeutic dosages. Both garlic and ginkgo biloba have been shown to play a role in thinning the blood. So if you're someone who is on blood thinners or has a bleeding disorder, should definitely, again, consult a trained medical professional before just picking it up off of the shelves at your natural food stores. Another popular herb in the treatment of heart disease is linden. And this is a really great herb, especially for people who experience heart disease and have a relationship with anxiety. So linden itself can help treat anxiety, can lower your anxiety and improve your response to stress. And it helps the heart. It strengthens the heart muscle itself and can actually, again, lower blood pressure. So it makes a great herb and can be used pretty safely for long periods of time.
Dr. Cox, I also understand that there are some nutrients, in addition to herbs, that can also treat cardiovascular conditions. Can you talk to some nutrients that are
Yes.
therapeutic in this regard?
Sure. So there's a couple I really want to touch on, one being fish oil. You all hear that fish oil is very healthy for you, eating fish a couple times a week. American Heart Association says eat fish 2 times a week. Wild caught, fatty fish such as sardines, salmon would be great, mackerel, to consume about 3.5 ounces per serving. And this is a great modulator for inflammation. Inflammation is a precursor for pain and or disease, pathology. Simply put, without inflammation, you can never have a disease state or pain for any matter. And I often tell my patients, blood vessels such as arteries, veins, capillaries, down to your toes and in your brain are extensions of your heart. So you want to keep that healthy, so consuming fish will be great. If you're eating it in diet form, in soft gel form, as you were talking about, in supplementation, you will want to consume higher dosage. But you have to be careful, consult with a naturopathic doctor or nutritionist, as it works as a slight blood thinner. So if you're already taking coumadin or warfarin and other types of blood thinner, you will just want to be cautioned in doing so. Also note that fish oil reduces inflammation in the arteries. It works on the same pathways, COX-1, going into little biochemistry, LOX, 5 LOX. Those are very inflammatory pathways.
Lose her.
Very inflammatory pathways where people are coming up with autoimmune, all sort of different heart conditions and concern, cardiomyopathy, angina. It even helps to reduce cholesterol, primarily triglycerides. So you really do want to make sure you're consuming fish oil capsules. Check with your physician to find out the dosage, or eat the fish 2 times per week.
Nice. Thank you. Actually, I have a question about the quality of fish. You know, I don't want to open up too much of a Pandora's box, but how would you tell your patients about consuming fish from the ocean if they're worried about toxicities? Do you have that kind of conversation with your patients?
I do. I try to encourage persons to focus on wild-caught fish. So this is the fish that you're not buying from individuals that are selling farm raised, where they're feeding it corn and adding other type of additives into the meals. The fish are just swimming in the ocean when they're caught. And go to your local health food store or any other store, they'll prompt you and let you know whether it was wild caught or farm raised, to try to focus on that aspect of it. In addition to, I also like to talk about quercetin. It's a very important antioxidant that helps to reduce inflammation significantly. It actually acts as anti-allergenic. So what it does is it reduces inflammation on all levels. It works on those same pathways we talked about earlier that causes different type of health concerns. And you could find this in foods such as apples and onions and grapefruits. So just eating those daily can get you great levels to keep inflammation down, because remember that arteries and veins are also connected to your heart, and you want to keep those organ systems healthy.
Nice. I was familiar with quercetin for asthma and allergies, not so much for the heart, so thank you.
Yes.
Once we come back, Dr. Gassford is going to explain to us an interesting form of therapy he specializes in called biofeedback. Getting regular health checkups with your doctor, like your annual physical exam, may be more important than you might know. They can be helpful in helping your doctor to identify those small risk factors before they become larger problems. And that can be helpful because then your doctor can put in a prevention strategy. Don't be a stranger. Schedule an appointment with your physician for your checkup today. Hey, we're back. Right before the break, we hinted at a special type of therapy that Dr. Gassford specializes in called biofeedback therapy. Now, this therapy has plenty of health conditions that it can be used for, such as anxiety, diabetes, migraine headaches, chronic pain, and even managing high blood pressure. Talk to us, break it down. What is biofeedback? Are you eating something? Is the biology talking to us?
So biofeedback is a little bit different because it does not actually pertain to something that you're eating or something that you're taking. Instead, biofeedback is actually the use of things we call mind-body therapies. So in biofeedback, the patient is actually hooked up to sensors, non-invasive sensors, that measure physiological output. And that might be your heart rate, your respiratory rate, how tight your muscles are, how much you're sweating, the temperature of your hands. And these sensors then display in real time those physiological results on a computer screen so that the patient can be there and see what their physiology is doing. But more importantly, the patient can interact with their physiology, experimenting with mind-body techniques to actually alter some of the physiological parameters that we're looking at. One of these, being high blood pressure, is affected by the way you breathe. So one of the modalities of biofeedback is respiratory biofeedback. And it's been shown in the medical literature that slowing down your respiratory rate and breathing at a very specific pattern, with certain lengths of time for inhalation and certain lengths of time for exhalation, can actually significantly lower your blood pressure. The way it works is a little complicated, but in general, by breathing slower at a specific pattern for a very specific patient, the side of your nervous system that is responsible for relaxation is activated. And one of the consequences of being more relaxed is a slower heart rate and lower blood pressure.
Makes sense.
So over time, using biofeedback therapy, a patient can identify a specific breathing pattern that they can use when they feel anxious, have an idea that maybe their blood pressure is elevated, or use long-term to lower their blood pressure significantly for the remainder of their life. So it serves as a great training method for any part of our body. We need to exercise it. So you can think of biofeedback as using your mind to exercise your heart and your vasculature. And all of that together can help lower the blood pressure and significantly make you healthier.
Using your mind to exercise your heart and your blood pressure. So biofeedback, it's like your biology, your body or your mind is giving you feedback and you're looking at it on the screen, quite literally.
Yeah.
Interesting.
The sensors are very sensitive and they pick up some of those physiological states. And it can be like a game for most patients. They see it on the screen, they try a technique, they change the way they breathe. And when it's doing what it is expected, say lowering the blood pressure or lowering the heart rate, they get to see an output of that. And they know right away, I'm doing something that can, in the long term, really help my health.
And then they're paying attention to it so they can continue to do that if once they're not hooked up to these.
With repeated exercise, biofeedback exercise, they become more acquainted to the feelings and the sensations that are associated with improving those physiological outputs. And so, yeah, you don't need to be in office with the doctor hooked into the biofeedback system. After you learn how to do it, you can do it in 5 minutes in your car while you're driving. You can do it 10 minutes before going to bed. You can do it when you feel anxious and you know that may be increasing your blood pressure. And so you train for long-term health.
That's really empowering from a patient perspective. More empowering than taking a pill, not to discount pills, sometimes you need them. But if you can take your health and the transformation of your health into your own hands, that's pretty remarkable. How quickly does it take to resolve or lower someone's blood pressure? How does that work? What can a patient expect if they wanted to try this out?
In a typical biofeedback therapy approach, and this is based on the research, especially for respiratory biofeedback and high blood pressure, a patient can expect to need to do 8 to 10 sessions with the doctor in order to identify proper breathing patterns, practice those breathing patterns to a point where it becomes more second nature. And then after that, usually the patient is able to continue those things with appointments at a regularly spaced time to fine tune it. It's like going to the gym. At the beginning, when you go to the gym, you learn how to exercise, and then you get better at it, and then you keep going back over time to push your fitness to the next level. It's the same with biofeedback therapy. The beginning is introduction, it's learning how to train with biofeedback therapy, and then it becomes something that you check in to really refine your results over time.
Any final thoughts for our viewers, either of you?
Yes, since heart disease is the #1 killer in the United States of America, it's just very imperative that people understand, the population in general understand the importance of identifying healthy foods such as the key nutrients and minerals and vitamins we talked about today, eating a dense, nutrient-dense diet, DASH diet. We talked about the Mediterranean diet, using coconut oil, olive oil to cook with, and just paying attention to what they're putting into their mouth. As you know, what you put into your mouth can either move you closer to health or further away. And the important thing to remember is the body is the only place you have to live in. So let's make it a clean home.
I like that. The body is an important place to live in. Make it a clean home. I like that. You want to add anything to that?
So I agree with Dr. Cox a lot about heart disease, and it is really a lifestyle and preventable disease. So focusing on things like healthy diet, not smoking, and exercise are all really important things that you can do on your own without seeing a doctor. Of course, if you do already have heart disease, these things can play a role in your treatment, but you should consult with your healthcare professional. Heart disease is something that we can address on a daily basis with the things we do, including foods, nutrition, not smoking, and exercise.
Yes.
I like that. Simplicity is profound, and no matter how complex the condition may be, when you start with those simple things, lifestyle, diet, your environment, your thoughts, your connection with people, you can actually build on that and have to use less of the more complex things to treat the condition or manage it. Perfect. I like that. Thank you so much, the both of you, for joining us.
Thank you for having me.
All right. You've heard it from our experts, Dr. Cox and Dr. Gasworth. Thank you both again for coming in, for sharing with us these simple, backed by evidence and science, ways that we can prevent and manage and treat some of these fairly common conditions. We appreciate that. Tune in next month when we talk again about colorectal cancer. What it is, how to stay aware, and how it could affect you. Again, my name is Dr. Abigail. This has been the Wellness Minute. Thank you for watching, and we'll see you next time.